Hello, I'm Mary Beth McIntyre, the Chief Programs Officer for the Medical Society of Virginia. Welcome to MSV's webinar on innovation, where we will discuss a wonderful opportunity provided by Lighthouse Labs and the Health Innovation Consortium. We are joined today by Erin Powell from Lighthouse Labs and Ace Callwood from the Health Innovation Consortium. Erin is the Executive Director of Lighthouse Labs and has spent her career creating connections, capital, and customers that have allowed founders in technology and beyond to build their dreams. No stranger to the high-growth startup scene, Erin's career has ranged from launching her own successful commerce brand to growing some of the region's largest software-as-a-service companies. Ace is an educator, speaker, and serial entrepreneur from Richmond, Virginia. He currently serves as the Director of Communications at the Health Innovation Consortium, the regional platform for validating innovations in healthcare, and as the network catalyst at VCU Ventures, the office dedicated to supporting VCU employees through new company creation. Operating through his brand and communications firm Equals Sons, Ace continuously crosses from communications to tech to entrepreneurship to corporate D&I. So welcome, Erin and Ace.
Thanks for having us. We're really excited to be here.
Thank you. Looking forward to the conversation today.
Yeah. So we'll kick off, and today we've got a couple action items. First off, we'll share a little bit about the HIC, where I spend the majority of my time. We'll dig into Lighthouse Labs Accelerator and the top tier acceleration that we have here in Richmond, Virginia. And then, of course, as we talk to all of the physicians who are tuning in, sharing how you can get involved with the HIC and Lighthouse and the partnership they're in. So we'll dig into it, but again, really happy and excited to be able to share what we do in the healthcare world with all of you. Cool.
Great. Sounds like a good agenda.
So we'll kick off with the HIC. What is the HIC is a question I hear often, and I think have gotten pretty decent at answering. At a very high level, we consider ourselves the Commonwealth's premier platform for healthcare innovation. And a lot goes into that, but at a very high level, we have pulled just some incredible partners together, along with an incredible team and support staff to look at new potential innovations, ultimately validate if and where they fit in the healthcare world, and then introduce those to our partners, of which VCU Health is one of our founding partners. So having a direct pipeline into the health system, really important for us to help move or facilitate innovation in the healthcare world. Again, our founding partner, VCU Health, VCU and Activation Capital really came together to help us answer a core question, and that is, how can we better facilitate innovation to improve care within health systems? This is one of those, it seems like a no-brainer that we ought to innovate in healthcare, and quite frankly, we do, often, regularly, and we can do that quickly, but there's this maybe balance of how do we provide best care, and how do we standardize that so we can provide care efficiently? And that's counter to the startup world that I come from, where we have this mantra, move fast and break things. And of course, as physicians, you can appreciate that perhaps in trying to keep a patient up and running, alive, we ought not move fast and break things. And so how do we marry those two ideas, the innovation that occurs in the startup world, the high-tech, scalable growth company world? How do we take some of the learning, some of the lessons, and some of the frameworks and apply that to an inherently innovative space, or one that is ripe with innovation? But how do we do that safely, intentionally, and conscientiously? And that was the question that VCU Health came to the table, VCU came to the table, and of course Activation Capital came to the table to try and answer. So we pulled all of these ingredients together. We have the innovators that come out of pipelines like Lighthouse Labs, this incredible talent regionally that we have here in Richmond and the surrounding areas. We pulled some health systems into the mix, which is requisite, and we'll get there in a second. We pulled investors into the mix, and as My mother likes to say the golden rule is he with the gold makes the rules. So having the appropriate folks at the table who fund a lot of these opportunities was really important. And then lastly, and this is one of the big things we talked about at the HIC with respect to our pipeline, is having end users in the mix. It does not matter what you build, it does not matter how well you build it or how quickly you build it or how interesting it seems if you don't talk to the people who actually put their hands on a tangible product and figure out if it works to solve the problem that they have in their everyday lives, their work environment, or in the clinical setting. And so having all of the right ingredients to make this beautiful masterpiece that we consider the HIC was really important for us. And then, of course, the frameworks. In the innovation world, we talk about lean methodology and design thinking, and there are multiple frameworks out there, but they really all distill down to a couple core tenets. The first of which is, have we asked the right question? How can we frame questions to appropriately find out what the problem that a potential user is facing or the problem that is driving a potential opportunity? Second, how do we gather inspiration? We've got to go see what exists in the market already. And I think often when we talk about innovation, we think about this thing that has never existed before, and we've got to create it brand new, and we've got to be, just wild and crazy about bringing this radical innovation to market. The reality is problems are often being solved in a multitude of ways. And if we go collect the information around existing solutions in the market, that helps expedite the process of figuring out what works, taking the best pieces of those, and then throwing away the things that don't perhaps work as well as they ought to. Therein lies the opportunity for the innovation work that we do. And then third, synthesize for action. Once we've gathered a bunch of information and feel really good about the problem that we're solving, what do? And that is, let's take the action items away from the inspiration we've gathered and the problem that we're trying to solve. Let's figure out the order of operations and the requisite work, the requisite team and resources that are needed to move forward. And then, and only then, once we've done all of that, do we get to building anything. So that brings us to the other half of this framework, the other three points that we think through often. The first is idea generation. And as I talk about pretty regularly, there's the 80-20 rule that exists in the innovation world. That's 80% of your ideas are going to be really bad. 20% of your ideas will be somewhat decent, or will have some interesting pieces that can help us move forward. And so when we're thinking about that 80-20 rule, if we come up with one idea or one potential solution to a problem, there's an 80% chance we're going to miss the mark. But if we come up with 10 or 20 or 100 or 1,000 ideas, perhaps we have widened our scope of opportunity to get to the right solution for our end user to solve the real problem. So that idea generation is an important piece, and we walk founders through this all the time. From there, we get into prototyping, making ideas tangible. How do we create enough value to prove that we can actually solve a problem? And then lastly, how do we test and learn? And that is often where we get to continue engaging with physicians in the healthcare environment. We put products in their hands, we put ideas on the table, and we see what resonates, what works, how we can improve. Because if we're not solving the problem for the people who use a product or a service, we have not done our job appropriately. And we take that very seriously as we innovate in the healthcare environment. So that brings me close to wrapping up the HIC intro, but I want to share some of the work that we've been able to do and the work that we expect to be able to continue, again, alongside a lot of the physicians who will be listening in on this conversation, and then, of course, with our partners at Lighthouse Labs. So within the HIC, in working with VCU Health, through COVID-19, we have become kind of the de facto or go-to innovation team of the health system. And what that means for us is not only are we helping founders navigate the regulatory environment, putting them through programs and thinking about prototyping or FDA approval around their health-related technologies, but we get to get our hands dirty. And as a team of operators and founders, that's what we do so well day in and day out. And this was an excellent opportunity for us to engage specifically around extending PPE access or usage in the health system. So specifically on the N95 front, what we found is that most health systems are on allotment for N95 purchasing, and supply chain put together a task force at VCU Health to figure out how we can extend our supply of N95 masks and other PPE. Specifically, we pulled the University of Nebraska's protocol for N95 decontamination, leveraging UVC. And we looked at that and said they can decontaminate 700 masks a day for a sizable hospital as VCU Health is. How do we up our throughput to better protect our frontline workers and make sure they are appropriately protected and feel safe as they come into work every day? So the question was, how do we up throughput? And from that question, we got to a couple solutions. The one that made most sense was to use some redundant space over on the MCV campus. We used the former Museum of the Confederacy space. We optimized the layout of that facility. We built new walls. We knocked down old ones. And then we built a series of trellises to hang masks on and then put in front of a TrueD machine in a dedicated room for decontamination. This process and the literature that accompanied that we wrote right here at VCU Health, that literature and protocol is now available to other health systems. And here at VCU Health, we got it stood up in roughly 3 weeks. We're running it actively, and we have the capacity to decontaminate 20,000 masks a day. That's real tangible work that was a collaborative effort across an interdisciplinary team. And it's important in how we pulled some of those resources together. We got asked to step into the mix to help move part of the process forward. And we were able to execute on that and deliver a product that ultimately decontaminates masks, protects our frontline workers, and I think is a just excellent case study in the type of work that we're able to do at the HIC, which brings me to my last piece. We can only do better and larger scale projects now that we've partnered with our friends at Lighthouse Labs. Personally, this is an incredible partnership because I'm a former Lighthouse Labs founder. I took one of my last companies through the program. I've been supported by the program here in Richmond for the entirety, quite frankly, of my entrepreneurial career. And for us, we're now able to expand our network with the Lighthouse team, which gives us access to mentors, functional expertise, being able to get the right folks in the room at the right time for these founders, the customer validation that I talked about, having an end user in the health system that we've partnered with, and then of course, having the investors at the table, so access to capital, being able to bring both the HIC's resources and Lighthouse's resources to bear for founders here in the Richmond region focused on healthcare innovation is paramount to us continuing to grow as a region and continuing to deliver world-class innovation right here from Richmond, Virginia. So with that, I'll pass it over to Erin, the Executive Director of Lighthouse Labs, let her share a little bit more about the program itself.
Great, thank you, Ace. And Ace brings up so many great points about entrepreneurship, creativity, innovation, and innovation is found everywhere. And we're sure that innovation is happening in the day-to-day environments that the physicians on this call are in the hospitals. And the HIC is such an amazing platform for testing those ideas, helping to start validate those ideas. And part of the reason that the partnership with Lighthouse Labs and HIC makes so much sense is because once ideas are in the market and they have some level of testing, acceleration by Lighthouse Labs can help really take that company to the next level. So at Lighthouse Labs, our mission is investing in the lives of founders. We're a very mission-driven organization, and so we want to take all of that work that founders have done to create their idea, to help validate their idea, and pair them up with the world-class mentors that we have here in the Richmond market that are extraordinarily knowledgeable with multiple different facets of business operations to really create a tailored, curated approach for those founders to really take their company from where it is when they come to us at Lighthouse to a totally different level when they leave us 3 months later. So an accelerator is really just that. It's a 3-month intensive fixed-term program. So, you know, we recruit founders and ideas that have had some level of validation of their product, and we want to be able to take them to that next level. It's cohort-based, meaning that founders that come in get interaction with other founders that are at a similar stage in their company's journey and evolution. And we give entrepreneurs the ability to rapidly scale their companies. So unlike, you know, maybe taking a business course, you know, or something like that, founders are able to take the real world application of what their company needs to move the needle on their business metrics. And it really creates that intensive and immersive experience through the access to mentors, investors, advisors, and other founders. You know, the secret sauce that Lighthouse Labs has and what gets us ranked in the top accelerators in the nation is just that. It's bringing together all of the constituents in our community that really help take these companies and these projects forward. So for a founder that gets accepted into Lighthouse, our acceptance rate is pretty low. We get hundreds of applications and we accept roughly 4 to 5%. So we're really taking founders that we feel like we can help on their stage of the journey. So we're providing a 13-week, you know, intensive course. This one that we're offering in the fall in partnership with the HIC is going to run August 24th to November 13th. And Lighthouse Labs will invest $20,000 of equity-free seed funding into each of the founding companies that are selected to be a part of the cohort. Of course, the founders will get access to the best mentors, connection to customers, you know, especially through our partnership with the HIC and VCU Medical Center, and some other follow-up benefits. You know, accelerators are a relatively new term in the startup community, and all in all, there are over 1,000 accelerators globally, and Lighthouse is ranked in the top 25 of those global accelerators. So we're really proud of what we're able to offer founders, and you know, are really able to make an impact as they go through our program. So we have been able to accelerate 48 companies in our existence. Those companies have created over 1,000 jobs. They've raised over 80 million in capital, and you know, a couple of the companies here listed have been in the health sector, whether it be, you know, device or health technology. You can see some of the folks listed over here on the right. And so what we look for in founders, we really want revolutionary ideas, so things that might change the way the industry operates in the marketplace. You know, one of the companies on the previous slide is Roundtrip, and so they were able to change the way that medical transportation was happening. So again, that was a revolutionary idea for the marketplace. We're also looking for evolutionary ideas. So there may be an existing process, product, or service that simply needs to be improved upon. And finally, we're looking for committed founders. So we do want people that are, you know, willing to quit their day jobs to focus on their company during the acceleration period, and people who want to take their business further and faster. You know, a lot of the concepts that will come up in acceleration may be things that these founders might face over the course of 18 to 24 months in their early, you know, evolution for their startup. But we want to condense that and have founders that are ready to see those ideas, you know, solve those problems and really move things to the next level in a short time frame. So what do we need from partners like the Medical Society of Virginia and the folks that are on the phone? We need you to help us spread the word to founders. So, you know, Ace mentioned this, but companies that don't require FDA approval, health technology companies, medical device companies, any startups that you may come across that you think might benefit from our program. We would love to have them know more and to apply. We're also looking for mentors in this space, and I'll talk in a second about what the mentorship opportunities are. A lot of the physicians on the phone, may be interested in taking a step out of, the day-to-day operations and interacting with a founder. Founders are invigorating, they're excited, they're really fun to work with. And, as a mentor, you can really see how your guidance and expertise starts to shape the early stage of these companies. So the mentorship is really, really important, and it's really a part of the secret sauce of success for our program. And then finally, we're looking for investors. So there will be opportunities for accredited investors to make connections with people that go through our accelerator. So if there are folks on the phone that are looking for investment opportunities, we would be happy to connect you through our community that way as well. So the piece that we thought physicians on the phone might be most interested in, the mentor responsibilities, the way that we do this during our accelerator program is that we have lead mentors and we also have advisors. And so the lead mentor piece is really a culmination of an event that we call Mentor Madness. And so it's just like what it sounds. It's a madness event where our founders that are selected for the program get to meet and greet with all of the different mentors in our community. And it's overwhelming for all parties involved, but it's meant to be that way. And it's a little bit like a speed dating round. Folks get to know each other, and the culmination of that is that there's a natural pairing that occurs between founders and a lead mentor that's going to follow these founders through the duration of it ends up being about 10 weeks of time commitment. And then the folks that either don't have that much time to be able to commit or, don't find a company that they really feel like they could help during that mentor madness are also part of our community of advisors. So every week during the accelerator, we will pull together all of the problems that our founders are experiencing that week. And the mentors that are subject matter experts will receive an email notification from us saying, hey, this founder is having trouble with this particular component of their business. Is there anyone that can help us or anyone that can point us in the right direction? And so that pool of mentors is really, really critical as well in helping to solve, kind of just-in-time problems and just-in-time needs. So those are the two, big categories that we're looking to create this fall of connections between founders and mentors. And so from a timing perspective, we will conduct a mentor training where we will go into this in much greater depth in early August. We're going to be hosting an open house, which we hope will be all in person, assuming that it's safe to do so, on August 27th. And then that Mentor Madness that I spoke about, that speed dating session will happen in the beginning of September. And then the lead mentors will post office hours every week where the founders will check in with those lead mentors on the progress of how their business is being accelerated and, really be able to utilize that one-on-one connection. And then finally, the 12 weeks will culminate in a demo day and an investor day. So the tentative, timeframes for those will be the beginning to middle of November. The demo day ends up being a huge event. Last year we had over 500 people out at the West Creek campus of Capital One. And the investor day ends up being a smaller, more curated list of accredited investors that are, seeking to learn more about opportunities that these founders may have to raise capital to take their business to the next level at the end of the program. So that's an overview of the mentors, the time frame. We do have a process for mentors that might be interested, and of course happy to answer any questions that may come up along the way. So there's certainly a number of ways to get involved. If anything on the webinar today piqued your interest, or you have other questions, or maybe you heard the webinar today and it's not something that you would be interested in, but you may have a colleague or someone else that might be interested, there's a number of different ways to get in touch. If you have a company or know of a company that might benefit and would want to apply to the accelerator, the applications are open currently and will remain open until June 14th. There's a link right there on the screen, but of course people can find that on the Lighthouse website as well. Anyone on the phone that wants to be connected as a mentor or an investor, specifically for the fall program for the timeline that I outlined, can reach out to me directly and I can point you in the right direction. And then, of course, anyone who maybe just has an idea and you don't have a company built out yet, you want to put your idea through the rigor that Ace talked about that the HIC is able to offer. You can access that information. I believe you can even submit your idea, right, Ace, through the portal.
Yep.
So, that link is provided as well, and Ace's contact information is on there too. So again, we are just thrilled about the collaboration between Lighthouse and VCU Health, Activation Capital, and the HIC that has been in the works for quite some time. And of course, our partnership with the Medical Society of Virginia is new, but we are really excited about the potential relationships that can come as a result of our health community pulling together for the purpose of innovation. So thank you all so much for having us. I'm going to kick it back over to Mary Beth for any closing remarks.
Actually, I have a couple of questions. If
Perfect.
you wouldn't mind answering a couple of questions.
Happy to answer those.
Great. So first I wanted to ask about, so if we have, if one of our physicians that's listening today does have an idea and is interested in being a founder and participating in this program, how far along should that idea be in order to apply for the fall cohort?
Yeah, absolutely. So, we like to cast a wide net with the folks that we're reviewing applications for. Typically, we accept companies into the accelerator that, already have an idea that's a little bit vetted out. They already have a team of people kind of pulled together. They might be bootstrapping their idea. They may not have any customers, or they may have a few customers. But at the end of this, we really want for that idea to be turned into a viable business model that can go out and seek either early stage or very early Series A stage funding. So that would be the level for Lighthouse. I'll let Ace speak to the HIC, because I know that's a little bit earlier than the Lighthouse Accelerator.
Yeah, the relationship, I think, very symbiotic in that respect, because the HIC is really the ideal pipeline right into Lighthouse for the stage that they like to look at. We'll take anything. So you can be a concept, Mary Beth, I think you and I were speaking a couple days ago, and one of the notes that I made is even the terminology of being an innovator, I think doesn't necessarily translate in the same way into the healthcare world as it does for us like tech entrepreneurs, So when we talk about innovators specifically, the idea is people who are seeing problems and solving them. And that happens so naturally. It occurs regularly in the healthcare environment, in the patient rooms, as you're at an admin level thinking about the opportunities in supply chain and logistics and operations. Often we see innovators who are solving problems, and the HIC loves to say, have you identified a problem? Are you thinking about it? Would you like to be involved in solving it? Have you put together an early solution? Or have you really started to build out a solution? We can support you from any point in that process. And then as you mature and potentially get to a place where you're generating early revenue or have put together some business formation, which we help through the process of, at that point, it makes a lot of sense to plug right in to to Lighthouse Labs, and given our relationship, nothing's ever guaranteed, but can certainly expedite at least the relationship to see if that's the right fit. So that's a long answer to a short question, but I think gives a good holistic view of the pipeline, if you will.
No, that's very helpful. Thank you. So then I just wanted to kind of cover back the different opportunities that physicians have. So obviously the founder piece is one, or if they have this idea to go through HIC. But what if they're interested in the mentorship, right? So first, if a physician is interested in being a mentor, can they work with more than one group, or is it just kind of one group at a time?
Yeah, so through the Accelerator specifically, if a physician wants to work one-on-one with a group and that pairing kind of happens naturally through that Mentor Madness event, then that would be where the one-on-one pairings would occur. For, physicians that may not have, the time, or, they may not be available to support a founder one-on-one, they could certainly be a part of our distribution list and, tackle those problems as they come up and, kind of raise their hand as a subject matter expert. Part of the challenge with advertising for mentors is that the applications are still open, so we don't yet know the exact type of companies that are going to be accepted into the Accelerator. So it's almost a chicken and egg type thing. So
Sure.
I would say, the short answer is, if you're interested in being a mentor, definitely reach out. And if this time, ends up making sense, fantastic. If it doesn't, you're in our database, we can communicate with you. This is certainly just the beginning of the partnership that Lighthouse has with the HIC and with the medical community. So I would say just err on the side of kind of raising your hand if you have any level of interest, and we can get you plugged in through the right component, because the right component could also be the HIC, which doesn't have that kind of 3-month limited time frame. HIC is always open, right?
Yeah, there's the ongoing engagement for what we call expert reviewers. So very similar to having a lead mentor or a subject matter expert as a mentor opportunity. We do the same thing, and that the line tends to be blurred of that database, right? Like, is it a good fit for Lighthouse, or is that physician perhaps a good fit for the kind of timeline agnostic opportunities that we have at the HIC to assess whether something might be viable? A new technology, would it fit in the healthcare environment? And then if there's interest in getting more involved with any specific company, that can either be with us as we get them prepped for Lighthouse, or through the Lighthouse experience, which is that 3-month expedited timeline for growth of the company. So ample opportunities to get involved, and because we're working very closely together, you can get in touch with either of us, and we'll make sure the right opportunity is matched with the right physician.
Great, thank you. So one more question about mentors. So what if a physician comes and participates as a mentor with this cohort, and then they have an idea that comes later? Could they participate as a founder in a future cohort or work with HIC?
Absolutely, the more the merrier. Bring it on. Yeah, I mean, if you get inspired and want to go build something after being a mentor, so be it. And kind of on the flip side, if you have gone through as a founder and have just this wealth of expertise and an experience with Lighthouse, always opportunities for mentorship. And so I won't speak for Erin and Lighthouse specifically, but I can say that I had that experience as a founder going through Lighthouse, and it continues to be rewarding. So that's how I think about it.
Yeah, absolutely. I mean, I think that there's no set rule, like, once you do this, you have to do this. I think that part of the beauty of our programs and, our partnership is that it's very fluid. And, sometimes we see overlap between mentors and investors, for example. So, sometimes people may want to make an investment of their time. Sometimes people may be looking to make an investment in an early stage company but can't invest their time. So, there's blurred lines sometimes between all three of those parties, founders, mentors, investors. So, we would welcome the opportunity for folks that want to get involved, and we can help point them in the right direction.
Absolutely.
That's great. Well, that's perfect lead in for my last question, which is a little bit more detail perhaps would be helpful for our physicians about investor opportunities.
Yeah, absolutely. So, Richmond has a pretty established, pool of investors currently. And so, there is a fund that is being pulled together, offers some due diligence assistance as part of this partnership between the HIC, Lighthouse Labs, and then just overall, all of the entrepreneurial projects that are going on here in our community. So, for someone that, may be making an investment for the first time, that may be a direction that we could point physicians so that they can get some support, from other investors in the community. But, over the past decade, Richmond has really, really grown, from both the founder standpoint, people coming up with ideas, the community to support those ideas, and then of course the investment to help accelerate those ideas. So I would be happy to start those conversations with folks and also point people in the right direction for other resources in our community as those would make sense.
Great, well, thank you. And I want to thank both you and Erin and Ace for joining us today. We are excited about this opportunity. One thing that we know about all the physicians that are members of MSB is they are, extremely innovative. We know that they innovate every day, whether they realize that or not. So we hope that this will be appealing for some of them. And I'm going to just tell everyone that is watching or listening that they can visit the msv.org, visit MSB's website and do /innovation. And we will have links for Lighthouse. We will have links for HIC, and we'll have all the information that has been shared today. And again, thank you so much for coming and sharing these wonderful opportunities.
Great, Mary Beth, thanks again for having us. This has been just an incredible opportunity to share, and we're looking forward to continually involving ourselves with the healthcare community here in town, because there's just some incredible work happening here in Richmond.
Thank you for having us. We appreciate it.
All right, thank you.